today. I went to take it today and I passed.
Oh, okay. Wow, wow. Congrats. So
Thank you.
how was the test? Did you feel nervous or?
Um, I was a little nervous going in, but of course I was listening to my Christian music. Got there, they were super nice at the center, so I calmed myself down and everything. Um, to be sincere with you,
Mm-hmm.
it wasn't hard. Everybody have
Mm-hmm.
their way of preparing for exam. Um, but it wasn't hard for me. I didn't. I normally, if I'm taking an exam and it's difficult, I start having headaches. None of that. I wasn't even stressed out. That's how easy it was for me personally. There were a couple of questions that was out of nowhere.
Of
Um,
course, yeah.
it wasn't even that many for me, if you ask me. Um, but this program has been amazing, and I didn't really have the time to go over the questions over and over again. Of course,
Right.
I did my module 1 through 5. I did the questions, um, the crash course, the 8 text bank link that you sent. I did only
Mm-hmm.
2 of those. However, the must do crash course questions under the question bank, I did those twice. And then I
Good.
went to my diagnostics 1 to 4. So I did the first one, the diagnostic one, that's what you take when you start the program. So I took that.
Right.
So at the end, I took it the second time. I did diagnostic test 2 1 time. I did the
Mm-hmm.
3 twice. I did the 4 once.
Mm-hmm.
But I noticed most of the questions on diagnostic test 4 almost
Mm-hmm.
the same as diagnostic test 3.
Yeah, I mean the content start to mix together
Yes,
at some point. Did you find the question bank, the crash course review question bank helpful? You know,
super. It's,
super helpful, right? So
it's
folks,
amazing.
I'm telling that is the new thing. If you are not doing the question bank,
Super.
every day today I added another question. I
Yeah,
can't be adding questions every day, so you have to be looking at it. You stop,
yeah,
I think it was at 12, yes, 10 yesterday. Today is 12 or something like that. So every day I'm working and I'm like, oh, this would be a good question. And I create a new question for you.
yeah.
But all the questions that are under the crash course review question bank, which is this right here, let me share because some folks still don't know where they are located. They are super high yield for you. I think they're gonna serve you well, even if it's not necessarily identical for the board. They're still gonna serve you well in the sense that they're going to prepare you. You are going to see a lot of things they're sharing in those question banks,
Yes.
whether through the rationale
Mm-hmm.
or not. They're right here that you can pick up from it and be able to you know
Yeah,
learn from your knowledge and answer those questions right. As I told you yesterday, that you had nothing to worry about. You should be good to go. you know just
yeah,
giving your history and what you have accomplished. Everyone, your goal should be exactly that. As you're doing the diagnostic test, that should be the real test for you.
mm-hmm.
You should not be waiting for, oh, my real test is on the 30th. No, you're like 10 days prior, you need to sit down and take the diagnostic test as if it's the real deal, because now is the time to find out what you don't know or find out what you really know, right?
Right. Yeah.
So,
So yeah, under the must complete, I did it twice. Um, what I'm going to say is, please listen to Dr. Lopez, do the question banks, and it's going to save you time because I'm a slow test taker. But if you are answering questions and you say, okay, this is similar, then you know the answer, you kind of click it and you keep moving on so that you can make it to the rest of the questions. So please, just listen to Dr. Lopez, complete the
yeah,
question banks, and you'll be good. And make sure you know your contact. Thank you already.
yes. Thank you. Good job and congratulations.
Thank you.
So, yeah, she said something that I think is very important. If you go too fast for the sake of doing it, even if you only say, oh, I'm going to take 3 weeks off of work and 2 weeks off from work and I'm going to work very hard, it may not work out for your favor. What you need to do is a steady and continuous pace, 1 hour to 2 hours a day, getting to know the content. Your brain is not made to study 12 hours and be able to keep everything that you study. So it's very important that you don't underestimate the amount of material and try to do it all. I have one student right now struggling because she tried to do everything in 2 weeks and it's not a good thing, you know. And I'm telling her, say, please don't pass, because I don't think you are going to pass, you know. But if you don't do the right things in the beginning of the course, you might get yourself in hot waters. Okay. So yeah. Now let's go ahead real quick. Rita, you
Hi,
have
Dr. Lopez. I
so
passed.
woohoo, woohoo. Did you take it today? Oh,
I did. I took it this morning. Oh my gosh. I'm
oh,
still trying to hold my nerves. I think my norepinephrine is really high. I just cannot rest. I'm so anxious.
I know. So tell me a little
Well,
bit more, like how did you prepare? How was your preparation? You know, in honest way.
so I think I bought this course in January because I was done with my school in early February. I bought the course, but I didn't really because I wanted to do the diagnostic test first
Mm-hmm.
before that, the pre-diagnostic test. I wanted to do that before starting the course. So when I did it, I was at 65%. I was like, okay, well, um, so I started studying in January, February, about February 15. That's when I actually started doing my modules from module one. And just like you said, I came every day after work. I work night shift, so when I wake up, I would do like 2 hours,
That's
and
it.
um, then I was very, I made sure to do at least one module a week. So I made
Perfect.
sure module one was done like in a week. And as I said, Dr. Lopez, your course is more than just the board. It's really, I could see how I'm going to apply this content going forward. That's one thing I like about your course. I was not just studying for the board. I have so many notes that I don't even know. I think I still have to write more notes.
Oh my
Um,
God. Yes.
yeah, yeah. And then for the exam, and I think I sent you a message last week when I took the diagnostic tests. I scored, I think my first one was 82. Then the last three were 88, 89. And I went back and the errors, I made sure that I didn't make the kind of errors again on the exams because I sometimes I
Yeah.
misread the questions. Not that I didn't
Mm-hmm.
know was because I was like, oh, I see why I didn't get it wrong. I got it wrong. So I made sure I correct those errors. Um,
Good.
and
Yeah.
then I think also sitting down for that long, one thing we don't realize is how long that exam is. Sitting down for
Mm-hmm.
75 questions and doing those diagnostic tests as though you are testing helps
Mm-hmm.
because you have to practice sitting down for 3.5 hours.
Yep. And this is why the first two diagnostic tests is timed. Now the last two, I give it the rationale. I understand that you guys are testing. Some of you guys are
Yeah.
testing very soon. So there is a mixture of the reasons why. The first two is more of a timing, so you can prepare yourself to sit down for 3.5 hours if you need to.
Yeah.
Well,
So
Rita, congratulations. I'm super happy that
thank
that
you.
things worked out that way for you. So
Yeah.
that's awesome.
And I
All
keep
right.
hearing your voice. I keep hearing your voice. I keep hearing your voice. I'm like, and so one thing, as I said, know your content because those questions they are tricky, Dr. Lopez. I tell you,
They
I
are,
would
I'm
read
sure
a
they are.
question. I already have the answer in my head, but then my answer in my head is none of the ones to be to pick from. I'm like, wait, let me read the question again, and then I remember you saying, does what I'm choosing answer the question?
That's it.
Does it answer the question? That's one thing students have to know. Am I, all of this sounds really good, but am I answering the question? So
Exactly.
that
You
I
have
kept thinking
to.
about.
Yep. That is very important because even if you have a correct statement, but it's not answering the core of the question, it is the wrong answer. All
Yeah.
right,
So I
Rita.
am very happy. Thank you. Thank you. Thank you.
All right. Thank you, everyone. All right. So we're going to get started today. And, it's a good practice to always go over what you learned. Now, when you go over, you already went through everything. Now you should say, what are the 8 Erikson stages, right? And then you go over each one of them. Obviously, I'm not going to go over each one of them, but it's very important, again, that you memorize the age. Age will be important. Age will help you answer and pick the right question for the board, okay? So let's keep moving on real quick. We talked to the field or I think is most important. I would not settle for those three that are highlighted: late school years versus industry versus inferiority, or identity versus confusion, because they're all important, right? So please take the time to learn them. They are kind of complicated because it's long, but if you use the PEG system, and then you take a little bit of time to memorize the 8 objects that was demonstrated yesterday, you'll be able to pick up those very easily. Erikson stage is something that I probably would write it down my own dumping sheet. I would write it on the stages and the age. So that way you look at the question, when you're tired, you don't have to think about too much. Okay. Then we went on to Piaget yesterday, and we said, hey, Piaget age does not matter, right? We talked about sensory modem. We talked about a borderline patient that is 35 years old having de-stress when the psychologist goes away, right? He's 35. Age for sensory motor is 0 to 2. Pre-operation is super high yield. They are egocentric, and they have the tendency to have abstract, not abstract. They have a tendency to have magical thinking. They may, you know, they may have a little bit of language issues as well, but it's kind of normal, right? So magical thinking is normal in pre-operation. Remember about concrete, the C for concrete is before the F for formal. Where we're looking at the concrete, we're looking at the concepts like conservation and reversibility. And finally, formal is super high yield, science projects, hypothesis, empirical thinking. These are formal operation. If you ever get stuck, think about the C and the F, because a lot of people will get stuck between both of them. Not now because we are covering, but during the test, okay? Then we went over a little bit more details over this. Piaget. We talked about the acronym, so Peter can fly, to help you remember the stages of Piaget. Then we talked about Fyodor's psychosexual stage of development, most high yield one, phallic stage, self-discover. Sometimes on tests they like to say masturbation, which is not necessarily an immoral thing, or something that it's it's not what make some people may think. Is basically self-discovering. So
Is it money? Because as I dey look at men.
sorry. All right, so playing with gender is normal for this stage of this 3 to 6 years old, right? Strong sexual feeling for members of the opposite sex. And then we talked a little bit more about the defense mechanism. There are tons of them. You should at least know those 8: displacement, sublimation, intellectualization, rationalization, repression, and then also reaction formation and autism fantasy. Okay, add those 2 to the list, please. They are very important. We talked about motivation therapy. If the question is about motivation therapy, you should cross out any answer that is confrontational. Okay, motivation therapy is not confrontational, it's non-confrontational. You want to avoid answers that are confrontational. We talked about how motivation therapy is conducted with this acronym ORS: open-ended questions, affirmation, reflection, and summarizing at the end. Most high yield about motivation therapy is frames. You need to know frames by the letter. F for feedback, R for responsibility, A for advice, M for menu, empathic, and self-efficacy. Okay. We talked about a little bit about trans-theoretical model of changes. We talked about pre-contemplation. That is in pre-contemplation, they do not know they have a problem, right? So do not give advice. Contemplation, they are kind of aware. I would not say they are fully aware, but they are aware, but not committed to a change. That is pre-contemplation. Now, when they have a plan, that's when they are into the pre-preparation phase. Finally, action is when they have taken a stance and they are doing whatever the plan was up to 6 months. When they cross to 6 months, then they are in the maintenance phase. In this stage, you are looking for your goal is to, advise the patient that they can still fall and reverse to what they were before, right? Usually motivation therapy has to do a lot with substance use disorder. We talked about Lewis state change theory. It's all about uh, unfreeze, change, and refreeze. And we talked a little bit about the driving force and the restraining force. Okay. And then we proceed with cognitive therapy. So if you are answering questions about cognitive therapy, it's all about the mind. If one of the answers is doing something that is a behavior, it is not the answer for cognitive behavior, cognitive therapy, right? Cognitive is just changing the irrational belief, the negative thoughts, and cognitive distortion. Now, when it comes to behavior therapy, it's all about doing something to change the maladaptive behavior. What are the things like exposures, relaxation, skill training, role playing, modeling? When we marry the two of them, now we have cognitive and behavior therapy, journaling and super high yield, and cognitive restructuring, right? Changing the way they think in order to change the behavior. All right, and I think this is pretty much where we stop. Now we can start the next class. Actually, we talked about DBT, very important, three things. Marshall Lineham, the goal of DBT is to decrease self-harming behaviors or suicidality. And what was the third thing? Marshall Lineham, DBT, the goal of DBT, I think it was only two things here. I thought I had three things for dialectical therapy. Okay, so the DBT, right, is for borderline, and the therapy is dialectical behavior therapy and Marshall Lineham. Okay, this is now where the class is going to start at the existential therapy. So let's start. Let's go ahead and close this and go on to the PowerPoint. So this is day 2 of therapies. And that's where we really start today's event. Okay, so as you see,